Hello students, now I am going to discuss about another topic according to your syllabus. Centrally acting muscle relaxant. These are the drugs which reduce skeletal muscle tone by a selective action in the cerebrospinal axis without altering consciousness. They selectively depress spinal and supraspinal polysynaptic reflexes involved in regulation of muscle tone, without significantly affecting monosynaptically mediated stretch reflexes. It does not alter consciousness and selectively depress spinal and supraspinal polysynaptic reflexes. Polysynaptic pathways in the ascending reticular formation, which are involved in maintenance of wakefulness, are also depressed through a lesser extent. They have no effect on neuromuscular transmission and on muscle fiber, upper motor neuron spasticity, and hyperreflexia. The prominent differences between peripherally and centrally acting muscle relaxant are listed in this table. Centrally acting muscle relaxant decrease muscle tone without reducing voluntary power, whereas peripherally acting muscle relaxant cause muscle paralysis, voluntary movement loss. In centrally muscle relaxant selectively inhibit polysynaptic reflexes in CNS, whereas peripherally acting muscle relaxant block neuromuscular transmission. In case of centrally acting muscle relaxant, some causes CNS depressions also. But in case of peripherally acting muscle relaxant, there is no effect on CNS. In centrally acting muscle relaxant, generally orally given, sometimes used parenterally. But in case of peripherally acting muscle relaxant, it always given through intravenous route of drug administration. This centrally acting muscle relaxant used in chronic spastic condition, acute muscle spasm, and in case of tetanus. In case of peripherally acting muscle relaxant, it is used for short-term purposes like surgical operation. Here, some classification of centrally acting muscle relaxant. Benzodiazepine. In this group, diazepam is a prototype of benzodiazepines, which act in the brain on specific receptors, enhancing GABAergic transmission, which facilitate muscle tone is reduced by supraspinal rather than spinal action. This muscle relaxant also used as sedative activity by dose ratio is low. There is no gastric irritation occurs and it is very well tolerated. Through sedation limits the dose which can be used for reducing muscle tone. It is particularly valuable in spinal injuries and tetanus. The sedation activity of this group of drug is limited in use. Combined with analgesics, it is popular for rheumatic disorders associated with muscle spasm. The next class is serental alpha 2 agonist. Tizanidine is a group of drugs recently introduced. Clonidine congeners is a central alpha 2 adrenergic agonist, which inhibit release of excitatory amino acid in spinal interneurons. It may facilitate the inhibitory transmitter glycine as well. It inhibits polysynaptic reflexes, reduce muscle tone and frequency of muscle spasm without reducing muscle stretch. Efficacy similar to baclofen or diazepam has been noted in multiple sclerosis, spinal injury, and stroke. Some adverse reactions also there, like drowsiness, hypotension, dry mouth, and some side effects are it is absorbed by orally, undergoes first pass metabolism, and is excreted by kidney. The T half of this drug is 2 to 3 hours. Our next drug is GABA derivatives. In this group, baclofen used as a centrally acting muscle relaxant. This analog of the inhibitory transmitter GABA acts as a selective GABA B receptor agonist. The GABA receptor have been divided into GABA A and GABA B receptor. As early we know, GABA A intrinsic ion channel receptor, which increase chlorine ion conductance and block by bicylcholine facilitated by benzodiazepines. Whereas baclofen does not affect chlorine conductance and its action are not antagonized by bicylcholine. It induces hyperpolarization, which serve as presynaptic inhibitory function. And toxicity of baclofen is drowsiness, increased seizure activity also. Our next group of drug is methicillin congeners. In this class of centrally acting muscle relaxant, there is present mifencin, carisoprodol, and another group of drugs.